Now, Dr. Calvin Roberts of New York's Lighthouse Guild joins Vance to discuss cataracts.
Thank you, Janet. It's a pleasure to have Dr. Roberts with us today. First of all, what are cataracts?
Well, in order to understand what are cataracts, you have to understand a little bit about how our eyes work. Because I think of our eyes as being like cameras, and they consist of a series of lenses that focus the light on the retina, which acts like the film of the camera in order to take the picture. And so we have two principal lenses in the eye that focus the light. And a cataract is when one of these lenses, instead of being clear, becomes cloudy.
How common are cataracts?
Cataracts are super common. As a matter of fact, if we all live to be 100 years old, we're all going to develop cataracts. And that's because I think of them as just a normal part of aging, and like wrinkles on your skin, we get cloudy lenses in our eyes.
I know you've mentioned age, but what are perhaps some of the other leading causes of cataracts?
Yeah, so it's fascinating because actually some people are actually born with cloudy lenses. And so there are children who are born with cataracts. There are people who develop cataracts as a result either of certain diseases that they have or related to some of the medicines that they take for their diseases. And so for a big example of this is people who take high doses of steroids, either for arthritis or for some immune diseases, that the cataracts that they develop are actually caused by steroids. And so often when we give people large doses of steroids for the disease, we warn them in advance that they may develop cataracts.
Well, Dr. Roberts, you've said before that cataracts are cloudy lenses, but what are the symptoms of cataracts?
So you can imagine that what happens with a cloudy lens, going back to our camera analogy, would be what would happen if you tried to take a picture when the lens of your camera was all fogged over. So would be the quality of the image. And so the number one thing that people notice when they develop cataracts is that they can't see as clearly. Now, this may mean that their reading is hard. Sometimes it's a blurry vision at distance. Another very frequent symptom of cataracts is the development of glare. And often people come to me and they tell me, gee, I'm having the hardest time driving at night. Oncoming headlights are just so glaring. And that is often an early symptom of cataracts. Now, let me give you an analogy which is so accurate. You know, I don't know about you folks in Memphis, but up here in New York, when there's snow on the ground, they come with this salt, and they put it on the road to melt the ice, and sometimes it gets on our windshield, and we get this white film on the front of our car. And if you're driving in the shade, you barely notice it. But if the bright sun hits your windshield, oh my gosh, it's so glary. That's the same optical phenomenon as what often happens in cataracts. And so you'll find so many people will tell me, I have no trouble seeing if it's shady, but as soon as it gets really bright, oh my gosh, I get so much glare.
It's funny that you mentioned snow because we had more snow this past February in Memphis than we'd had in over 30 years. But continuing, Dr. Roberts, how can someone find out if these symptoms are caused by cataracts or another eye disorder?
Right. Good question. And really, the only way you can really know for sure is to have an eye doctor check your eyes, because cataracts are very simple for eye doctors to diagnose with the equipment in the eye doctor's office. So the eye doctor will be able to look into your eyes, do some simple measurements, and let you know whether it's the cataracts that are causing your symptoms.
And we know that early intervention is very important in counteracting many health problems, but how important is early intervention when dealing with cataracts?
Probably less important than with other conditions because of the fact that the eventual treatment is going to be surgery, and it's going to be removal of this cloudy lens and replacement with a new clear lens. Well, it turns out that with the exception of waiting for it to get terribly, terribly bad, the surgery is not that much more difficult or that much more complicated in moderate cataracts than in early cataracts. So that usually what we say to our patients is, if you feel like you can live with your vision the way it is, with the quality of your vision and the amount of glare, if you can live with it, sure, it's fine to wait. And then when you get to the point where you say, you know what am I waiting for? My vision isn't what I want it to be. The glare is bothering me. I think it's time to take care of it. And that's the time that we say, okay, now you're ready.
Dr. Roberts, you've already mentioned the treatment option with the removal of the cataract, but are there any other treatment options for someone with cataracts?
So often when people have cataracts, they often have maybe some other conditions going on with their eyes that is contributing and adding to the amount of visual problems they're having. So often people develop something that we call dry eyes. And dry eyes can really decrease the quality of vision and also can cause glare and just from the dry eyes. So often I'll have someone who has early cataracts but has dry eyes, and if I just can treat the dry eyes, well, their symptoms become that much better that they can wait a little bit longer before having cataract surgery.
And what are the chances that if a cataract develops in one eye, that a cataract will develop in the other eye?
The standard type of cataracts, they're just as the result of aging, they tend to progress in both eyes at relatively the same rate and the same pace. Occasionally, and it's not very common, but occasionally someone may get a cataract as a result of an injury. They got poked in the eye or got hit in the eye, something may happen. And in that case, sure, the eye they got injured may develop a cataract sooner than the other. But in general, you find that the two eyes, the cataracts develop at about the same rate.
So if surgery is required on both eyes, is surgery done at the same time? Or if not, what would be the interval between surgeries on the different eyes?
Traditionally, we've only operated on one eye at a time, even though both eyes need surgery. And why do we only do one eye at a time? Well, that is that it's surgery. And while the risks of surgery are slight, this is one of, if not the safest surgery around, unfortunately, things do happen. And you want to be sure that if something's going to happen, it only happens in one eye, and it doesn't happen in both eyes. And so that's the reason why traditionally we've done one eye at a time. But recently, over the last 5 years, doctors have become more comfortable in operating on both eyes at the same time. Now, why would you want to do that? Well, it's just for convenience. That the patient only has to come to the hospital once, has to only go to the doctor for their follow-up visits once at a time, not doing the whole thing and then turning around and starting with another hospital visit, another set of examinations. So for a convenience point of view, so that you get the rehabilitation done as fast as you can, doctors have started to do both eyes at the same time. What's been holding it back actually turns out to be more administrative than medical, that insurance companies and Medicare and Medicaid, they don't want to pay for both eyes at the same time. And so the insurance companies and the payers have been saying, no, you can't do both eyes at the same time. You can only do one at a time.
Generally speaking, not wanting to paint with a broad brush, but How successful is the replacing of a cloudy lens with an artificial lens in restoring adequate vision?
I think it's brilliant. And so many people have told me that they love the way they see. They feel like they're seeing the way they did when they were teenagers, that they see colors so much clearer. People are just delighted with the way they see after cataract surgery. The recent advances in the technology has made it such that the surgery is quick. It takes maybe 10 minutes, 15 minutes often at most, and then the recovery is just a couple of days, and then people are back to doing everything, full activities, so quickly. And so I think that cataract surgery is really one of the modern medical miracles.
And my final question, Dr. Roberts, how can our listeners get more information about cataracts?
And there are many great ways to get it. And the one that I prefer is that the organization that represents all ophthalmologists is something called the American Academy of Ophthalmology. And their website is aao.org. It's pretty simple, aao.org. And they have a wealth of what I would consider really factual, unbiased information on their website that is easy to read, easy to understand, and you can feel confident after you go through this information that you really understand cataract surgery and understand what it's all about.
Thank you so much. We've been speaking with Dr. Calvin Roberts. One spells that last name very simply, Roberts. He's an ophthalmologist and president and CEO of Lighthouse Guild in the Big Apple of New York. This is Eye on Vision.
That's all for this week's Eye on Vision.